Trump and blessing all the trap niggas. I'm in the streets, I hope you know I ain't just rapping with you. I had my back against the ropes, you started acting different. We may resemble, please remember that the package different.
Welcome to Humility of Humanity. This episode will talk about healthcare disparities. I'm glad to have you all here. This is going to be an interesting conversation. It's also a humbling conversation. So let's get into it. Healthcare disparities. What does everybody kind of know about?
Yeah, it'll be pretty fun because we have honestly a variety of people here with different healthcare experiences. Like for me alone, I had healthcare from the military for a long time, and then my dad and stuff like that as well. But then you two, I believe, moved here. You were from Nigeria, and we were just talking about that earlier. And I'm sure it's drastically different over there as opposed to how it is here in America. So that'd be one of my main curiosities. Like, how is it over in Nigeria and like other parts of the world?
So interesting that you bring that up. Actually, I was born here.
Okay.
I've experienced healthcare actually in Nigeria. Totally different. But when we think about the healthcare system, what I wanted to say is sometimes we joke about this. In the military, we talk about TRICARE, WICARE, and other
Correct.
things.
Yep.
And those are colloquialisms for those who don't know. It's kind of, we go back and forth about how people have access to certain types of care, or they don't feel they get optimal care, and they kind of joke about the healthcare name. It's an important topic, but I want to focus it on what we're doing here in the States to make it more wholesome for everybody in here. So what do you think about healthcare?
So when you talk about disparities, the word disparities for me is synonymous with the word of discrimination. And being a Black woman who has a chronic illness, I have experienced my own discrimination in the healthcare system. I was diagnosed with multiple sclerosis in 2016. I was lucky to get diagnosed very quickly after my first hospitalization, but I experienced a lot of racism during that time. I had doctors that would not listen to me. I had doctors that would tell me, oh, you're fine. I would see a doctor one day and the next day go to the ER for symptoms and things that were going on, the ER that was associated with that doctor's office, and they would check my chart and say, there's no record of you coming in. They were not charting the things that were happening. They were looking over me. They were ignoring me. I would be in the hospital. I had seizures as a result of my MS. And let me just back up for a second and kind of explain what MS is. So MS is multiple sclerosis. It's the immune system attacking the melanin sheet on the nerves. So if you think of a charger cord, when the plastic starts to unravel from the cord and you start to see all the wires inside, that's what MS does. It attacks the body. So your body thinks something's going on and it's fighting against itself. So people will normally have lesions on their brains, on their spinal cords. I have several lesions on my left frontal lobe, and I have lesions that are still up for debate in my spinal cord. So they impact your body in a lot of different ways. It goes undiagnosed for a lot of years. It's one of those things that lies dormant for a really long time, and you have to go through strenuous testing to get diagnosed. But unfortunately, with Black women, they don't hear us because there's that stereotype of you're strong, Black women are strong, we can beat everything, or we're overreacting. And I've had doctors tell me, oh, you'll be okay, or you're overreacting. One of my symptoms from my MS is seizures, and I've actually sat in a seizure unit for 3 days, had testing. I've had seizures show up on these diagnostic testings, and I had a white doctor walk in and tell me, oh, you're not having seizures, you're just depressed.
Wow.
Little did this doctor know, I'm a licensed professional counselor. I do depression inventories all the time. And I had to look at him and say, did you give me a Beck depression inventory? Well, what's that? You can't tell me I'm depressed if you haven't done an inventory on me. You can't tell me I'm depressed if you haven't done a diagnostic testing. What you're doing is assuming that I'm just this young Black woman who has these things going on. I'm from poverty and I'm just depressed and I'm overreacting. What you're doing is discriminating and refusing to look at the details in front of you.
Absolutely.
And what you mentioned there are a lot of things that a lot of people miss. There's so many things in what you said. First, I want to say I apologize on behalf of my colleagues. As you know, I'm an emergency physician. I'm biased a little bit. But also, there's a misnomer about the medical records. So people usually think when you go to one doctor, it automatically comes to the emergency department or the emergency department associated with that hospital. Most of these healthcare communications don't talk to each other.
It's not that easy.
So they're in silos. They're starting to break that barrier by people having their own personal chart. That's one thing. Aside from that, the other part that you mentioned is them not listening to you. And that's a common thing. I've had a couple of cases where some people actually went through to see their OBGYN. They say they had contractions, and then all of a sudden they're ignoring them. They think they're being fussy or being rude or being disrespectful or just being annoying, or you're a complainer.
Yeah.
Nothing's wrong with you. And we had actually a case of a good close friend of ours, actually, I think all of you actually know her, who actually had an incident with her child, and her child actually came out, the face was blue, what we call cyanosis, where there's not enough blood supplied to the brain and the tissues of the body. But fortunately, the baby came out fine. But that shows some of the things that we're seeing in society. I think you were saying.
Yeah, I have a question for you, I guess. You mentioned like racism and stuff. What made you think it was like not doctors' negligence and like it led to racism? Like you were like, well, like what part was like, this isn't a doctor just like not listening to me. This is, yep, because I'm black. Like this is what it is.
When I went to him and told him I almost crashed my car because of some vision issues, and he told me I was a dizzy broad.
Wow.
That's wild.
I don't think he would have.
He said directly, just said dizzy broad. He was like, you're just
called me a dizzy broad. Maybe it wasn't racism. Maybe it was sexism.
Yeah.
By that time, I had been seeing him for about 3 years.
Okay.
And I walked out. I went to my car and I cried. And that's when the importance of patient advocacy came up. I learned, you know what? I'm not dealing with this anymore. I'm not going to have a doctor tell me I'm a dizzy broad when I almost just crashed my car on the turnpike because of my MS symptoms. So when we talk about patient advocacy or self-advocacy in the healthcare system, it's scary, right? You don't want to speak up against your doctor. He's the expert. There's that kind of sense of...
I think you can trust him. Like, you know, he knows.
You trust him. He knows. He's the authority.
Yep.
You don't know me that well, though, because you're not listening to me. I know me well. So I wrote an email. I complained. A lot of healthcare systems now, especially the bigger ones, they have social services. So you can reach out to one of those. But everybody has a supervisor. Everybody has a manager. There's a manager for that particular specialty department. I reached out to the manager. I did one of those, what do they call it? At the end when you leave the doctor's office.
Survey.
Almost like
I
a
did a
Yelp
survey.
review.
Yep, I did a survey and I wrote to the manager and said, listen, this man called me a dizzy broad, and I immediately got a phone call back because they don't want that information getting out in social media or in the world, period, right?
business.
That's bad for business.
Yep.
And they said to me, well, normally we don't let you switch neurologists in this practice, but under this circumstance, we're gonna allow you to. Because it was a sexist comment, and they knew, and Bruce, you're the legal person, you know, they knew that it could be grounds for a lawsuit. You can't call a woman a dizzy broad. That's just not acceptable. And ignore my healthcare issues.
Yeah, so you bring up something. By the way, let's get both of you all in on this. I think you have a story, and then we can hear Bruce's legal side on this, and then we'll kind of tie that up.
I was just going to add to what you said with the sexism. I have experienced it a lot just as a woman with my OBGYN, who is an old white man. And then when I was diagnosed with breast cancer, the first doctor I went to, I'm not going to name like the hospital, but the way that I was treated, first of all, I was diagnosed with breast cancer. My mind was blown. I felt like I was in a daze. My husband died April 25th of 2019 from stage 4 esophageal cancer. So I am a single mom of 4 kids. So when I was told that I had breast cancer, I could not think clearly. And I remember going to the first doctor, and he was talking to me like this was no big deal. And we're talking about my plan, which was a double mastectomy, having my tubes and ovaries removed, and taking an estrogen blocking medication, letrozole, for 10 years. This is all a big deal. So let's just start with a double mastectomy. Like, I'm literally having my breasts amputated. That is a life-changing surgery. It's very emotional. You can never feel your breasts again. I mean, it affects your life on every level. And he told me, he said, I said, well, what's the recovery like? I don't know anybody that's had a mastectomy. And he said, you're gonna go home, you can do your hair, you'll be doing light housework the day of. And I'm like, what are you talking about? It was insane. I gave him the benefit of the doubt, and I went to talk to the plastic surgeon because I was having a double mastectomy with an immediate implant reconstruction. He treated me the same way. I said, well, when can I go back to teaching ballet? He goes, oh, a couple days, just wear a big sweatshirt. I was going to have drains. I had drains on the side of my body for weeks. And he said, yeah, you'll be fine. Like, they were totally just treating me. They don't know what I had to go through. So I switched over, and the female doctor that I went to was completely disgusted with what I told her that the male doctors told me at the other practice. She treated me a completely different way. And that was just my breast cancer journey. I've also had issues with my OBGYN. Just to touch on that really quick, I never planned on having children, and I actually have 4 children, and I love them so much.
How that
big
happened?
difference.
Come on now.
I don't know. I
It's
don't know
big.
how that
All right.
happened. It's just-
Hey.
One time we can understand,
That's
but
a
the
whole.
third,
That's a
come
very
on.
long story. But no. But when I had my 3rd child, I right after I had her in the hospital, and it was in my plan. I told them ahead of time, I need to have my tubes tied. Like, I'm not leaving the hospital without my tubes tied. And my white old man OBGYN was like, "You're too young to make that decision." And I'm like, "No, I'm not. I have 3 kids. I'm good. I don't want to have any more children, and this is my body." They conveniently could not do it. They were too busy. So I left the hospital without my tubes and ovaries removed. And just a side note, I have tried every type of birth control, even a copper IUD, because I don't do well with hormones. So I have tried all of the birth control. I just cannot handle it. I have side effects. Anyway, long story short, I wind up getting pregnant. My younger girls are 15 months apart. So when I went to see him, naturally, I was pissed. And I just looked at him like, well, thank you for that.
Here I am again.
Here I am, 2 seconds later, having another baby. But so after I had my last, I just told them, like, I am not leaving this hospital without my tubes tied.
So yeah, to the point of what you're mentioning, actually, that's actually going on within society. You know, a group of white men are now making decisions on policies for women. But that's a separate topic. We'll put a pin in that for another day. Bruce, I really wanted to hear your take from the legal system on this. And before you do, there's a whole point of advocacy that people need to know about, right? So patients have to really know how to navigate the healthcare system. It's very difficult, and if you don't navigate or get somebody to show you how to actually work through the system, you'll be lost or you'll be taken for granted. And we know that this happens to Black women definitely within the system, and sometimes you have to be, as some of my colleagues said, be a combatant within the healthcare system. So Bruce, what can people do when they've come to that wall and they haven't been able to get through the system, or maybe even where there's harms that have happened to them? What's your thought on that?
Well, this is actually a very complicated issue because no one policy could solve all the issue, because this is not only the history issue, there's also the economic issue also. You know, so what people always say is, or the lawmaker, what they always want to do is, if you want to solve this, you should at least from 2 angles. The first is inside the healthcare system. The other is outside the healthcare system. For example, the inside healthcare system, you have to train more, capable person to provide the healthcare, and you have provide people a more easier way to access to those healthcares. But outside, you also have to educate people, how they could have a healthy lifestyle, and even the housings, everything, because it's all about economic. So I also want to share of some of my experience about the healthcare in the U.S. because beside attorney, I'm also an immigrant. So a lot of people think you're immigrant, so you don't have a healthcare here. Well, that's actually wrong. My personal experience before I bought the insurance from the school, and 8 years ago when my son was born, so he's a premature, so he lived in the hospital for 15 days. And when I see the bill, it's like $10,000. No, it's not $10,000. It's $100,000. It's a lot. When I see the bill, I'm really surprised because that amount of money I could pay the down payment to buy a house here.
You're gonna have to pick up overtime, buddy.
Yeah, I don't work for some minority time. Yeah, the issue is I'm actually crying for 2 days because I don't know how to deal with it. So, but I'm pretty glad I go to the welfare office, and when those social workers see my bill, they say, oh, this is just a BS, we're gonna help you to take care of this. And after 3 weeks, they call me, hey, your bill is gone. Everything is fine.
Wow.
So, well, yes, so from a certain point, I think I'm a beneficiary from the healthcare here. Well, even though now I haven't received my green card yet, but I still have the the health insurance.
You get healthcare and stuff like that.
Yeah, some healthcare from the government.
That's good. That ties in with Obamacare, which I'll get into. But some of those things where to bridge the gaps and identify those barriers to healthcare access as an immigrant or whoever you are, that you are able to at least access care. That's people's dignity. That's important. It's a service that people need. It's a right. Some people may feel different about that you're able to access care. And a lot of people that I know, especially when they see me in the emergency department, they don't have access to that care or that bill that's not going to get paid that the hospital is sending to the patient. And that's another issue. There's no transparency around bills, about expenses. You don't know what you're getting into. You can't really shop around as well, so that's something to address. But I want to go back to the main core of our discussion while we're talking about these disparities, about racism, because it is about racism, it is about social justice, and I think you had mentioned about your experiences and what you had witnessed and experienced as a Black woman.
Absolutely.
I think it's important to really drive that down and make sure we're clear on those experiences and what's really right and wrong. We've talked about the legal piece. What do you think?
Yeah. Well, I'm glad that Bruce brought up his wife, having a baby, because I'm not sure if you guys know this, but Black women are dying at a higher rate than any other race in giving birth to a child. Why? Because of racism. You're not listening to us. There is this stigma, this idea, this myth that we have this higher tolerance for pain. Do we physically have a higher tolerance for pain, or is it because nobody listens to us and we have to internalize all of it? Because saying to you, I'm in pain, and you not listening to me gets me nowhere, so I keep it all in, and then you think, oh, she's okay, she doesn't need this medication. No, I'm not okay, and when I tell you I'm not okay, you don't listen. So what's the sense of me even speaking up? When I tell you I don't feel ill, when I feel ill, you're not doing anything to take care of me. A lot of us are suffering in silence, because when we speak up, we're still silenced. The racism, you asked me, is it sexism or is it racism? I 100% believe a lot of it is racism. With me having MS, there's not a lot of research on Black women that have multiple sclerosis. We're not represented. If you think about multiple sclerosis, over the years, you see an older white man or a white woman with a cane. You don't see a young Black woman that looks like me walking around every day that has multiple sclerosis. People look at me, you have MS, you're sick? I am. And I have to look at myself in the mirror and say, no, you are sick, something is wrong. But because society puts out this notion that, oh, Black women are strong, Black women can get through anything, oh, you'll be fine, or you're just crying, or you're just making a fuss, or, as Black people, we are inconvenient to white people at times, right? Oh, you're speaking up, you're too loud, you need to be silenced, you're getting in the way. Why? Why are you threatened by my voice? Why are you threatened by me saying I don't feel well? Why is me not feeling well not okay? Why do I have to put on a happy face? Why do I have to smile? And doing these things lead to mental health challenges because we cannot speak up. It leads to depression. It leads to anxiety. Oh, the angry Black woman. I'm not angry, I'm depressed. I'm not angry, I'm sick. I'm sick, you're not listening to me. I'm physically sick, I'm mentally sick. So it's not just sexism, it's racism. You can't sit here and tell me that if we both go into the doctors, we're gonna be treated differently. Treated the same. We're gonna be treated differently.
Yeah.
My doctor looked at me and said, do you want to be a part of a study? No. And do you know that he still took my medical information and submitted it to be a part of a study because he did not have enough African American women on his caseload when he was studying multiple sclerosis?
That's a legal issue, one, and that's an ethics violation.
So Bruce comes in.
And it's, yeah, go ahead.
Sorry, not to interrupt, but I have a question for you as a doctor and you as a lawyer. What can we do to change it? Because that is absolutely unacceptable.
So
I don't know if it's just Black people and stuff. How are these? I don't know these stats because I didn't look up stats on races of people going to jail, and I'm sure a lot of the audience didn't either, or not going to jail, but going to the hospital. And you said your records are being sent out, not proper treatment. How are these stats calculated?
Yeah,
because I don't know. I don't.
So I would tease them out. So there's separate compartments. So the one issue is with regards to Black women. Let's just call it up for what it is.
Yeah. Correct.
Black women being basically ignored due to racism. And we'll go back. Let's pull this back to the historical context.
Is it kind of like the form you filled out? Sorry, I didn't mean to interrupt.
Before then, let's pull it back to the historical moment. So there's a book, nicely done, unfortunately, but it talks about medical apartheid. Literally, where Black women were tested in terms of their threshold. Their hypothesis was Black women or Black people, but we'll use Black women. These were tested done by some OBGYNs. That they don't feel pain.
Oh my God.
or in some cases, they don't feel as much pain as other people, so therefore we can experiment on them. And that was what was being done. It's atrocious.
Gotcha.
So that's
Long time ago,
facts,
right?
Yes,
Yeah, okay.
historical facts, context. Fast forward to today, and we still have some of these issues. While they may not be experimenting in that same sense, but we have hearing aid lacks. We have so many different things that where black people have been violated. So, and now we're focused on the black women, and now she's talking about medical records being actually used for IRB testing. I was a researcher, I was an assistant professor at a university a hospital system where we actually have to get consent and assent to be able to perform studies or even get your blood specimen to do that. And that's a violation, that's an ethics violation. That should have been something that you can file with the Institutional Review Board. IRB is what it's called.
That's
Go ahead,
crazy.
Tyler, I'm sorry. Yeah.
People almost think my family's black. That's literally how we get treated when we go to the doctors and stuff as well.
Oh, let me stop you. Let's
Okay.
not compare, right? Let's not compare apples to oranges. I hear
No,
what you're
I was just
trying
going to
say.
state my story.
And I hear, but let's not compare, right? As a black woman and you're a white man, you're going to be treated 10 times differently
I agree.
than I am. So I
Definitely.
thank you for trying to do that and express that commonality. Excuse me.
No, you're fine.
But let's not do that. With all due respect, because my experience and your experience is going to be way different. We go to the doctor's office. You are a black man. I am a white.
He's a white man. You black? You turn black?
I told you guys.
He does listen to Savage, though.
You are a
But
white
that's
man,
all right.
and they're going to automatically assume that you are educated. You are top of the line. I'm
Oh,
a black
not
woman.
once I open my mouth. They're like, no, he's not educated.
I gave birth to my daughter, and I was in the hospital. I had the nurse ask me 5 to 6 times, I lied to you not, wow, you're married and you're having a baby? Wow, I can't believe you're married. Wow, you have a college education? You have a master's
Yes.
degree? Oh, 5 to 6 times I'm in birth. I'm in labor, giving birth to my child. And I had to look at my child's father and say, if this woman asks me one more time
Beating her with the baby.
that I'm married and I have a master's degree, and she's so astonished, why?
Yes.
I'm an anomaly?
Wow.
There's not other people that look like me?
So-
but if you walked in and you were giving birth to a baby, she's not going to ask you, oh my God, you're married?
Right.
Oh my God, you're this? She's not going to be astonished. Why? Why can I not have that? Why can't I be the same as you? So while, again, I appreciate you giving your story and what you're about to say, let's not compare apples to oranges.
Yeah, I do agree.
Yeah, I
There
mean-
are distinctions, so I think that's a very important correction.
Yeah,
so,
like we were
to
so
your
distinct.
experience.
Like my mom had to go to she had to go to Canada to get her treatment because they didn't want to do it here. So because that's who she was, but they had other people in there getting treatment, and so it wasn't just her. She has
Yeah.
a paralyzing nerve disease and everything, so they had to send her there.
I'm sorry.
Same with my grandma in the hospital, wasn't looked after, and then we go in and we're like, what's going on? And then ends up having to get both her legs amputated because of lack of care and everything.
Wow.
So we're coming here saying it's racism. Maybe it's more towards the medical field. I mean, I've had family members amputated body parts because she's white. Is that it? Or do we have maybe a lack of doctors that actually know what's going on?
So I think there's
you
a,
were
con-
saying-
There's a
there's
lot
a
of different
combination of
issues.
issues.
There's a multiple things,
but I
it's
think
not always
it's
just straight
good to
race,
get the
like-
gauntlet and slam the table and say, we clearly understand there's an issue, that racism is an issue, according to CDC.
Yeah, racism is real. I'm not
AHHA.
saying like they
Yeah,
weren't racist,
so
but
for,
there's
for
also
the
lack
medical
of doctors
piece,
that
there,
know.
there sure there may be doctors who don't know what the hell they're doing. I know I've worked
Yeah,
with
you
some
know that for sure.
I've worked with
Yeah.
some colleagues, but a good number also know. But a good number also grew up in a medical institution that already is racist. So
Yeah.
we acknowledge that, and I say that full-heartedly as a medical doctor. Yes, our system needs to be thrown away and revamped, and I think they're starting to make some changes to that. So I'm not going to sit up here and say we don't have racism within our system. Yes, we do. We profile patients. We do that.
Yeah, everyone does that though. Like everyone does profiling. It's impossible to not judge someone just by like looking or thinking at them. It's
Yeah,
we all like to think we don't. I mean,
I actually have one question. So, well, since I'm not grow up here, so something I don't know. For example, your case. So, if you, I mean, because here's a melting pot here, right? So people are from like a different country, different races. So, I mean, just for your case, if you think you are treated by an African American doctor, do you think the situation gonna be different on your case?
I think if I'm treated by an African American doctor, they may listen a lot quicker than a white doctor will. But the other thing is there's not a lot of research. Again, I said that before. There's not a lot of research on African American women having MS. Why? Because a lot of us don't want to participate because we're scared because of racism. We don't trust you to take our information. We don't know what you're going to do with it. You know, we're not that far removed from the Tuskegee trials. We're not that far removed where people took advantage of us from a medical standpoint. So the assumption is not that my treatment is going to be better as far as the medication, but you're going to listen to me and hold a space and have more empathy for me as an African American woman. My doctor currently is not an African American woman. She's a woman. She's a mother, and she gets it. She sits with me for an hour at every appointment and goes through every scan and asks every question. She does not recoil when I question her and challenge her. My previous doctor, an older white man, he would recoil. He would get mad if I questioned him. Our sessions were, our appointments were 25 minutes tops. And everything was, oh, you're okay, oh, you're fine, oh, you're fine, oh, you're okay, oh, you're okay. I could walk in and my legs, he could see that I was unbalanced. Oh, you'll be fine, oh, you'll be fine. This woman, oh, Kresence, you're not feeling well, your legs are unbalanced, your stability's off. Let's get that PT referral. Let's get this going on. You need to see the spine doctor. Everything that I have going on, she addresses. She never makes me feel like I'm overreacting. She never dismisses me. She listens to me. She makes eye contact. She will pull up research. She will say to me, hey, you know what? I don't have the answer for that, but I'll get you to somebody that does have the answer for this. This man would never say that. I would bring empirical articles to him talking about, you know, different medical ways to treat MS from a holistic standpoint. And he literally said to me, well, you can do whatever you want, and walked out.
Yeah. It wasn't Dr. Google though, right?
It wasn't Dr. Google, no.
I'm just saying, I'm just
Doctor,
saying.
it seems like does the doctor role and isn't like, I don't know, the patient, are you done here type of thing.
It was one of those, are you done here? My brother came with me. He worked for the VA, so he had access to a lot of scholarly articles and things like that. And he brought that evidence with him. He brought a whole portfolio. And this doctor was so offended that somebody came in bringing him empirical evidence to show him different ways to treat it. And he was so offended and walked out and said, you can do whatever you want.
That's a lack of empathy, yes.
I have a couple things to say. So interestingly, I was diagnosed with breast cancer in March of 2021. I went through my treatment, and then as soon as I was finished my treatment, my mom was diagnosed with breast cancer in December of 2021. She lives in Colorado, so she started going to doctors out there, and she had a doctor say to her, because she said, my daughter just went through treatment, she had a double mastectomy with immediate implant reconstruction, I would like to do the same thing. And her doctor said to her, you don't need breasts. Basically saying, like, don't worry about the implants, you don't need boobs. Wow. And she called me freaking out and said, I need to fly to New Jersey and see your doctors. I said, you absolutely do. But the other thing I wanted to add, my first doctor, and this just shows the difference of how I was treated between the male and the female doctor and just the different practices that I went to. So when I was being explained the whole process of what I was going to have to go through with the mastectomy, my first doctor, the male doctor, said, you come in the day before and you have an injection in your nipples. And he looked at me and he said, it's extremely painful. And I'm like, okay, like that doesn't sound fun. But he made it sound like there's no other option. Like you just have to come in and get this really painful injection in your nipple. And I was like, well, that sucks for me, but okay, I guess that's what I have to do. When I switched over and I had a female doctor and I told her what he said, she was horrified. And it's such a simple thing that she does. She calls in a numbing cream to my pharmacy. I put it on after I shower the day of surgery. I put it on, and by the time I got to the hospital, everything was numb, and I didn't feel it. So that's the difference. I have a male doctor saying, it's extremely painful. You're going to get a nipple, injection through your nipple. It's very painful. And he just looked at me like, I don't give a shit. And I'm like, cool, that sounds great.
What I'm identifying here, in addition to what we've all been talking about, is there are some elements of obvious racism, sexism, and this is a microcosm of our society. I mean, this is a real talk. It's what's happening all around. So I'm not doctor bashing. I'm a doctor, so I'm biased in a sense, but we have to own our own shit, so to speak. And that's me being perfectly candid. I don't feel apologetic about that.
And that's why advocating is so important, because if I didn't advocate for myself, and it was tempting to stay with the first doctor only because time was of the essence. I knew I had breast cancer. I didn't know how aggressive it was. Is it growing every minute, every day, every week? I don't know. I don't want to have to delay having a mastectomy, but I could not stand the way he was treating me and talking to me, and I did not want him operating on my body. So I was like, you know what? I have to go find another doctor.
And you made your own decision, again, to the point of advocating for yourself. And if you don't know how to advocate for yourself, find someone who does.
Yes.
Or find a doctor friend, a medical person who's in the medical profession. Or if you need to seek legal advice, because sometimes some of these things don't happen. So the quick hack is, if you're in a healthcare system or hospital system where you're having problems accessing care, or they're giving you a hard time to get, I don't know, medication for your child or for yourself, or they're just not treating you right, there's an ombudsman. Fancy word, O-M-B-U-D-S-M-A-N. Ombudsman. It's basically, that's the lesson for today. Ombudsman. Go read that. That's our special word for today, boys and girls. But yeah, that's who you need to see. Basically, they report to the CEO of those hospital systems. That's the trigger. That's where you kind of ratchet it up and tell them and complain, I'm going to report your hospital. I'm not satisfied. Also, the other second hack is you can actually call HHS, Health and Human Services, or you can call CMS, which is Center for Medicaid and Medicare Services. They're the ones that actually fund the hospitals and pay the payers and pay the insurers. So if you mess with that, they will actually go to the hospital, investigate, and they don't want that problem. That's the quick hack.
And I think you mentioned earlier, and I know that a lot of people feel this way, and I did before my husband had cancer, you kind of feel like, you know, they're in a position of power. They're so smart. They went to medical school. You're a doctor.
You want to
Like,
trust them. Like,
you
I
know,
want to
look,
you
trust
just
them.
automatically want to trust them.
Yes.
But what I want people to know, like the biggest takeaway that I want to get through right now is that the doctors actually work for you, and you can hire and fire as many times as you need to. It's not fun. It's not easy. It's time consuming. It's extremely stressful, but you have to do what you have to do. Like, it was not easy for me to switch over and, you know, push my mastectomy off for several months, but I never regretted that decision because I'm so happy with my doctor. I'm actually very good friends with her. As you mentioned, she's a female. She's a mom of 4. She will sit down and talk to me for as long as I need to. She actually cares about me. I'm just not, you know, on a conveyor belt, like, oh, another surgery. I'm not just a number. I'm not just a chart. Like, she actually cares about me. So that's what I want people to know, is that they work for you. And if you are not comfortable with your doctor, you need to get a new doctor.
And to your point too, having a chronic illness or any kind of medical condition that is chronic and extreme or acute, tap somebody in, because it's tiring trying to manage all of that and the appointments and the this and the that and the records.
Very.
Tap somebody in. Get a friend to go with you to an appointment, or get somebody to make that appointment with you. Tell somebody what you need, because trying to manage that all on your own is damn near impossible. You said you have children. I have 2 children of my own. Even if you don't have children, tap somebody in, whether it's a friend that is a medical provider, a nurse, a doctor. Maybe it's your mom, maybe it's your grandmom, anybody that says, you know what, let me lend you a hand, because you can't do it all by yourself. And people will make you think that you can, but you can't, and you don't need to.
Right. When my husband was battling stage 4 esophageal cancer, he could not do any of that. So I was doing all of it, and it just made me think. I never had to think about that before, and I was thinking, how do people survive just cancer, for example, the chemo and the surgeries and all of these appointments? They can't. My husband couldn't think clearly. He was very sick. And I was just thinking, thank God he has me to do it, and I was happy to do it. But people that don't have somebody to advocate for them, and they are too sick or old or whatever to advocate for themselves, I don't know how they survive.
It is difficult. We talked earlier, your background in Nigeria, and I was like, everyone I know that's Nigerian, a lot of them are in the medical field. But you were talking about tying people in and stuff. But like before, like with my family, when we have some wrong, a lot of time we'll just go to them, because it's a lot easier with people you know and trust. You're like, great, now I got to schedule an appointment. Now I got to do this. Now I got to do that. Like I said, my mom has like a paralyzing nerve disease. So instead of scheduling all these appointments and then we get booted to the back and we have to go all the way to Canada to get procedures, which sucks and everything, but we can just go to her and she'll be like, oh, I'll come over, let me see what I can do and help it out. So it is awesome having to tie people in. Not everybody knows someone who's in the medical field, but I mean, a lot of people know someone who's a nurse or like a school nurse, their friends in medical school. So if you want a second take, I would ask people like that and stuff like that.
I agree.
Well, I have an interesting question. So, since Dr. Dan, you're in the medical field, so every time, I mean, if I want to make an appointment, you know, it's always gonna be, I have to waiting for like 2 weeks, sometimes even a month. So do you know what is the reason for this? Are they really that busy, or is because some other reason behind it?
They're on a
They're
lunch break.
golfing. No, I'm joking.
I wish. Dude.
No, the real talk is not that just golfing. Our healthcare system is jacked up. It's just, it needs to be revamped, as I've said before many times. And yes, so there is a backlog of patients. And people in our society now, it's more about I want it now, here now, and we want microwave responses. And sometimes there's certain conditions that can wait, and there's certain conditions that can't wait. So most of those patients actually come to the emergency department to see us now. They don't even go to their primary care doctor, their medical home, which they know all their stuff, and that's why they come in with the story that, oh, I told my doctor all of this last week and it's in the chart. No, I don't know your
charts, you
doctor.
don't got it,
I'm just trying to get the story. Just help me out here. You got to start all over again. And then you have to wait like 4 to 6 hours before I get in that room because I have somebody who's having a seizure, somebody who just had a heart attack. This one just got hit by a bus. I have a gunshot wound. And you come in here with, you had a swollen leg for 3 weeks, and okay, I'm gonna get to you, but I have to prioritize the things, and that's the reality as a system. It's not being cold, but when I, for example, walk into the room, I'm gonna say, I'm sorry that you had to wait. There's gotta be the empathy. We're human. Everybody just wants to be respected. So I get that point to your question about why you have to wait several weeks. And people have to know how to go use their primary care. Like schedule it, call in advance and do those things. And you should find primary care doctors that have like special kind of hours where they extend maybe on a weekend, or they extend their hours on one day or a week a little longer so they can get you in. If you're not able to get into your doctor, flip it up and switch. Get another doctor. Real talk. But I also want to talk about Obamacare. It's important. I think it's been very helpful for several families to address our healthcare disparities, being access to care, cheaper medicines, drugs, people who have insurance, even myself, getting self-employed insurance where if you're not working through an agency or you're just independent, you're able to access care. And those who haven't even had insurance in the past were able to get insurance. Biden's update on that has been helpful with regards to prescription drugs. You see all the things that are going on now, which are forcing certain insurance companies to cover certain drugs, and also pricing for drugs. Those still have an area of work, but I think that's been very helpful in starting to address some of the healthcare disparities that we're talking about. And there are lots of social determinants of health I think it's important to just quickly highlight. It may be just your geographic location, your zip code, or your economic status, be it poverty, or education where they don't have the knowledge base to know about disease or to know how to navigate the system to be able to advocate. So we have to really address those things, and I hope that through this discussion we're starting to get there. Was there any last thoughts by anyone about this?
Go ahead.
I wanted to touch on what you said about the appointments, because I actually I have tons of stories, but I have a recent one from a few days ago. So I had ACL surgery last November.
That's your anterior cruciate ligament, for those who just
Yes,
wanna know.
and I actually had a new procedure that just came out recently, the Bear implant procedure. But I have swelling behind my knee, so it wasn't going away. My range of motion was stuck for like 2 months, which is very frustrating. And so 2 days ago, I went to my doctor. They did an x-ray. The x-ray was fine. They did a quick ultrasound, and they literally told me, like, we don't know why you have fluid behind your knee. You need a duplex ultrasound. They said, schedule it right away. So I left and called from the parking lot, and I said, called the radiology department. I said, I need a duplex ultrasound immediately. They said, okay, the soonest we have is April 18th at 6 p.m. Okay, well, I'll take it because that's all I can have. I called yesterday and I said, I need to get in for a duplex ultrasound right away. I'm just calling to see if you have any cancellations. They said, can you come in today? And I said, well, no, I'm busy, Friday. But they said, can you come in Saturday morning at 9 a.m.? And I said, absolutely. So I just also want to add that sometimes you just, like, going back to advocating for yourself, like, you just have to be persistent. And it's not fun. It's not fun to call all the time, but I went from going in April 18th to going in tomorrow. You know what I mean?
Yeah,
like,
it's
it's
a lot
just like,
significantly faster.
yeah, because they said they don't know if it's a blood clot. Like, that's a serious thing.
Yeah.
Like, I can't wait until April 18th.
And I wouldn't say, so if they were concerned about a blood clot, just full disclosure, you need to go to the emergency department. Okay?
He said, come see me.
Come to,
I
come
mean,
see me.
I
Okay?
thought, but I even thought that was crazy. They
Yeah.
said, we don't know what it is.
Duplex is basically looking at flow, and it's identifying the blood flow if there's a clot and things like that. So if they're going to recommend that, they should try and get you in quicker. If they couldn't get you in quicker, then you need to seek acute care, which would be the ER. This is the only one time where I would tell you to come to the ER. Only one time. Okay.
Maybe
That is
I'll-
good. That's good
maybe I'll
advice.
go
Keep
there
calling.
later.
And call stuff.
They usually have wait lists, so they'll say, "Do you want to be put on a wait list?"
And
so
I-
if there's a cancellation, they'll
Yeah.
call you right away. So that's another way.
And
to
I
get it quicker.
was, but I thought it was interesting because I do think they're getting better. I do think certain areas are getting better because they did say, we'll put you on the cancellation list, but she's like, side note, she's like, you should just call all the time, like every day and see.
See if
So I
there's
did.
cancellation.
So I called
Yeah.
it. So I called the next day and they were going to get me in today, but I'm going to go tomorrow morning. So that's just another thing a lot of people don't know. Just keep calling.
Yeah. Be persistent.
A lot of people don't want to be persistent though. Like you were right about that. Like I didn't want to call again, but it's like
They feel like
you
you're being
did,
annoying.
and then you're there. Then
Yeah,
It is
like be-
annoying.
yeah. But they have a wait list, like you were talking about.
It is annoying.
It's okay, you
And
can
you
be
also have
annoying
to
'cause it's your
understand that,
health.
you know, it is your
Yeah.
health. So people have to make
You gotta
that
pick and
judgment
choose,
pick and
like,
choose.
I'd rather
You
be
might not
annoying
call
and
every
alive,
day.
like-
Definitely don't call the emergency department because we're not going to actually give you
Yeah.
a medical care over the phone. We have to see you. That's just a violation of a medical law and
Yeah.
policy. So we're not going to give you information on the phone directly. But your doctor's office, yes, you can call, you can be persistent. I think these are all important things to advocate for yourself about. This highlights something that a lot of people experienced during COVID also, to the point of what you're mentioning. In that moment, people's diagnosis got delayed or they didn't seek care because we were locked up for a lack of a better word. But I'm sorry that, and I want to say, as I've said to you all before we even started the set, I apologize on behalf of the medical profession. I'm not trying to take all their guilt, but this
Well,
is
it's not
a
all of them.
microcosm.
You don't
And
gotta apologize.
exactly, I'm
There's
not
good- like,
bashing
to
doctors.
say everyone's bad
I
is
actually
not
love
it.
my doctors. I love
Oh,
my.
yeah, there's good doctors.
Yeah,
out
like,
there.
there's-
Yeah, but you have to
yeah,
just
You have to
practice
seek them out.
advocacy.
Only if they're
It's all about
Nigerian.
advocating.
Yeah.
You have to seek them
I
out.
know.
They're all not bad. I haven't had all my doctors, all my specialists haven't been bad, but
Yeah.
I've spoken up to get to the good ones I have now, and
That's-
I fight
Yeah.
hard to keep the good
That's
ones that
the
I have
important
now.
part
Amen.
that everybody needs to know. You can't just go to a doctor and it's like, well, this is it. This is my doctor. If you are not comfortable, you need to find
Switch.
another doctor.
Switch. Find a good one.
Absolutely. There's a lot of different bread companies, right? You go in the aisle for bread, it's not just one bread company, it's not just one label, it's a whole bunch.
Wonder
so
Bread.
it's Wonder Bread,
Wonder
Wheat
Bread.
Bread,
Yeah.
all the
Yeah.
types, all the types
Y'all
of
gonna
bread.
start a fight now. Okay.
Seek out the bread you need.
Okay.
Yeah, I'm glad you bring the Obamacare because, well, I know Obamacare give a lot of people in poverty and minorities and access to the healthcare system, but I also see there's an issue here. Is I don't know how you think, because what I think is, in here there's a severe issue about substance abuse. I don't know whether I use the correct words. So do you think if people are easier to, access to the healthcare, it's gonna have incentive to always go to the doctor, always get those medicines? Because from what I know, every medicine they kind of have side effect, because
Yeah, there's no perfect drug.
because sometimes I even feel the hospital they're over treating people, because sometimes you don't need to have it, but they're giving to you. Give you an example, probably not a very good example, because I know some kids they have ADHD, right? In here, what they're gonna ask you to do is just give some medicine to your kids. But sometimes what I feel is you don't need
Teach 'em.
Yeah, just teach them, right? You see how Asian
I
parents,
teach some
right?
martial
Just
arts. I know
teach
how
them,
they are. They
right?
need-
Teach them.
yeah.
They will listen. You don't need any
A
medicine.
pill's not
on
always the
them.
answer.
The interesting thing to me is I agree with what you're saying, but then I feel like there's so many situations that I've experienced, especially when my husband was physically suffering from stage 4 esophageal cancer. He was in excruciating pain, and it was sometimes hard to get him pain medication. And I'm like, telling the doctors, he's actually dying. Give him all the things. Give him morphine. Give him whatever he needs. He is actually dying. He is not a drug addict. He's not trying to, get high. He's in excruciating pain. There were times where they would not give it to him, but I feel like they do just dish it out.
random, sometimes different
ADD,
people
here
and
you
stuff.
go.
Yeah.
Here, we'll just give you all the things. And then sometimes people
him a
really need
tablet,
some
so they
things.
call it a
Push
day.
a pull within the system.
Yeah.
So the pendulum swung one way before, where medicine was given out willy-nilly and just kind of easygoing, especially you all heard about the cases with the opioid, which led us into this opioid crisis. And doctors are also part of the blame, but there was other systems at play. Also understand their patients, this happens all the time actually, where patients come in, they complain they want a medicine, they want an antibiotic. Classic story. For a cold. And I'm like, you have a cold. You don't need antibiotics. But if I take the antibiotic, it'll knock it out.
You'll be good in a week.
No.
Like,
Right,
just
you'll be good in a
relax.
week.
Like, you'll be good in a week.
So when I stick my ground, I don't prescribe antibiotics for viruses. But they'll say, okay, you're not a good doctor. I'm going to go to the other doctor who's a good doctor because they give them the medicine. So now certain doctors, or at least at that time, I think it's depending on the swinging back to your point, that where they dish out the medicine because then they're like, oh yeah, I'll just give it out to them. They go, they're happy, and I get a good rating. And that's what's at some of the core of those things. I'm not a fan of medicine, even though I practice medicine. I don't like using drugs myself. I don't like giving them out. And I think we've kind of seen how this, the opioid crisis is also affecting us. And that brings up another issue if we want to get into it, and it'll probably be in your lane, which is basically with regards to mental health related issues that we, are going to probably need to talk about that's related to that for those being on substance abuse. And we don't have even spaces. Look at our teens right now. We don't have place. They come to the emergency department. Yeah, we kind of give them something to calm them down, but what about the chronic, the long-term things that they need, the steps? And then even for mental health issues, we have to keep them in the ER or certain places for several days to weeks before we can get them a bed to a mental facility to be able to do that. So we have a big problem.
Well, I also think physical fitness is neglected a lot. Like you were talking, your kid, or not your kid, but a kid goes and they just give him a pill, and it's like, physical fitness is proven to help with a lot of stuff. And you were just talking with the flu, it helps sweating it out, going for a run, getting all that. And I feel like there's a lot of just like, here, just take this pill. Like, here's your prescription, you're good. Like, have a good day. And it's not as much, and you do a lot of with mental health and stuff. And usually a lot of people that work out consistently and their diet and keep track of all this stuff have less mental and physical problems. They're not perfect. I'm not saying you're never going to get a guy that goes to the gym not come to you for mental health or physical health, but it does help a lot. And there's some to it when someone's like, yo, go take a walk, that it actually does something for your body.
And that works in, so we can also play the other side of that in neighborhoods that are safe, where you can actually go out and play and can go hang out. And if you're worried about getting shot or getting hit or other things, I'm not trying to make any excuses, but there are certain pockets, and how do we do that, and how do we actually maybe have a safer neighborhood where they can actually participate in those activities, or how
or like
can
your
we
school
educate
gym
them?
or something like that.
Yeah, or how we can educate
Planet
people,
Fitness.
the population, on, hey, this is a virus, it'll run its course. These are the things, give them tools that they need to do, and people are not into this microwave, I need to be quickly fixed right now, and I'm not going to tough out these 3 days of the flu or 7 days of the flu. I need some, for example, Tamiflu or whatever, and things like that. And I don't prescribe that because I read the data, I know the data, I don't feel it works for certain of my patients. Only my high-risk patients I would prescribe that to. And you have a specific window period, and that's just an example, but there are many others that I could talk about.
It's so interesting because I've had primary doctors who have, I literally walk out of my appointment with like a whole handful of different prescription, like actual paper scripts that I don't even want or need. And I'm like, I'm not even bringing these to the pharmacy. And then on the other end, when I mentioned earlier that my primary doctor disappeared when I really needed an MRI script for the whole breast cancer thing, the new doctor that I found, who I was really just going to for the MRI script, but I also mentioned to her that I don't have a history of anxiety, but when my husband was dying of cancer, I did have a panic attack, and it was the scariest experience of my life. So I always had a very low dose of Valium, like just in case, because now I'm a single mom of 4, so if I started to feel anxious, I would just take one in case of an emergency. And when I went to this new primary doctor, she looked at my chart, but she said, I don't prescribe that. And I'm like, well, I just want it just in case. And she said, I just don't prescribe it. So I just didn't have it. And that was a really scary feeling until eventually down the road, my other primary doctor came back in the picture. But it was just so interesting because he's back to being my primary doctor, and he does overprescribe. I will say that. He will
Just write you anything.
like,
Write
if I go
everything
in
down.
for a checkup and I won't even say anything, and he'll be like, "Your nose is stuffy. Here's Flonase. Here's." I'm like,
Here's
I
some
don't.
Xanax,
Yeah, and I'm
like,
like, I
have a
don't
good
even
day.
want all of that. So I just take it. I don't even bring it to the pharmacy because whatever. But it was just a really scary feeling to go to a doctor who refused to prescribe even a low dose of Valium, and I don't have a history of abuse, and I don't even have a history of anxiety, but I just needed it just in case, and she would not give it to me.
Yeah, doctors aren't perfect. So to your point of that, there are certain ones who have been burnt by maybe a case or a story. So I ain't doing that. Or they've seen what's happened with society in there, and I'm on that. So if you came to me with that, I'll be like, sorry, I'm not giving you that. But I can talk and help you talk with our social work, and
Right.
they can get you in touch with psych, and we can schedule something. Or if you needed 1 or 2 days or something like that. But long term, no, because I'm not under, you're not under my care, and I'm not able to follow you. And because of those reasons, especially from an emergency standpoint, I'm good.
But
I
if
do
more
my shift
doctors
in a
like
route.
you,
Yeah.
like doctors who care and
Yeah.
take the next step, like maybe I won't prescribe
Yeah, we
it
try
for
to
you,
problem solve,
but
exactly.
I'll give you
Not
another.
just pill pop. and
Yeah,
like,
yeah,
you
not
gotta get
pill-
out
yeah,
next.
yeah,
like,
yeah, nah.
Dr. Dan, it's interesting you said about our culture now, kind of the microwave culture, and we were talking about children diagnosed with ADHD, and you have such an alarming rate of young black boys being diagnosed with ADHD. Mothers are bringing them to the ER because they got in trouble at school, and they need to be seen to come back as they're having all these outbursts and things like that. And you're ER doctor, right? So microwave, you're acting out. Let me give you something for this ADHD, but we're not really sitting and looking at the origin of what's happening. Is it ADHD or is it something else? Lots of times it's trauma.
Or is it a kid being a kid?
Or
at
is
the
it
end
a
of the
kid
day?
being
Like,
a kid, right? You bring a kid and you say, he won't sit down in class, he's moving, he's talking, he won't sit down, he has ADHD. Does he have ADHD, or does he live in an environment where if he sits down, he may not survive? So for survival purposes, he has to keep moving. Is it PTSD, or does he have high lead levels in his system? There's a medication, there's something you can take, and I might be wrong, you can correct
you're
me,
correct.
to correct those lead levels. High lead levels in young children also represent behaviors that look similar to ADHD. So lots of times children will present with those behaviors, and doctors don't unfortunately test them because they want to get them in and out and give them a quick fix.
And also diet. I mean, everything needs a holistic approach.
Absolutely.
I don't think anything really just needs a pill thrown at it. But not every doctor has the time or is going to take the time, which goes back to advocating. You have to find a doctor that has the time to give you, to listen to your whole story, what you need, and not just throw out a prescription for it.
Yeah, and lead testing is actually part of routine pediatric care. So when you go to your primary doctor, they should be doing this at about 1 year or 2 years of age. They usually check them. But if you've moved to a different place or at an older age, it may be part of the symptom, and it's one of the differential diagnoses, meaning other things you have to consider when a child is acting out or having some type of mental health-related issues, encephalopathy, things like that. So checking the lead level is very important. There's treatment for it. So to your point, I think those are important things to consider.
Awesome.
Yeah. Other thing?
Yeah, no, I think there's a lot we can all take away and stuff, and then some of the smaller stuff, like you were saying, like plan in advance, call multiple times. That can change 10, 12 days, 2 weeks, even just for you for your procedure and stuff like that. And then just smaller stuff. Even there's a whole broader thing. But there's certain stuff like that. Even like individually, all of us can change and make little progress.
And I just want to say, like, I am in no way bashing doctors. I have great doctors. I think they do a great job at what they do. Extremely smart, talented,
Thank
and
you so
caring.
much. Yeah.
But it's the person. It's your responsibility to advocate for yourself. It's not the doctor's responsibility. So if you are not comfortable with their plan of care for you, you need to either take it up with them or find a new doctor. So I don't want anybody to think I'm bashing doctors, because I'm not. I have some amazing ones. But the takeaway from what I'm trying to say is to advocate for yourself.
I totally agree with that.
Another point is, medical field for me is very, very special, because in the medical field, mostly those professionals got covered by the insurance. So do you think the insurance is really helpful for the healthcare system, or sometimes harm? Because some people could abuse the insurance, and of course the patient doesn't care, right? Because I got covered by the insurance. Sometimes I hope legal like this way too, because I could earn more. But anyway, so Think about this: if everything got covered by the insurance, so do you think those medical professionals going to be more money driven and cause, like some discrimination too?
So we've had there's certain, what I hear you saying, I just want to make sure I'm understanding what you're saying, is for providers who are covered or procedures that they do and things like that, all covered by insurance.
Yes.
Patients can come in, they can order whatever. You think that it might incentivize the doctors to do more tests?
Or like they'll be more money driven. I want to spend more.
It could be if there's money there, but there are already cases where this has happened, where insurance companies said, if you don't order these tests, we give you money to do as additional to your salary or your bonus. So there were some where some doctors wouldn't do that. It doesn't happen as much anymore because it's a different kind of pay system. Actually, insurers tend not to cover this stuff, so your doctor is supposed to be your advocate in a sense, because they're like, why didn't they cover this test, or they didn't cover this prescription? And with the advent of Obamacare, some of these loopholes have been closed, but there's still some gaps that need to be addressed. But it can, and money can incentivize anybody. If it's in the wrong place and there's some type of conflict of interest, you have to assume the worst case scenario. But yeah, it has happened where patients weren't getting certain testing because they get paid. If you don't order the MRI, then you cut costs. And so you have to make decisions between that. So healthcare system was affected by insurance in that case. I don't think it's happening as much anymore.
Awesome. Share your insight as a doctor for this one. It's good.
Yeah, it does. I think we covered a lot here. I mean, we covered everything from racial disparities within the healthcare disparity. We talked about sexism. We talked about the legal ramifications and how you actually can solve some of these issues and where you need to actually pursue, if you need to pursue legal action. And we talked about military experience. We talked about personal stories from our individual experiences that we all had. And I think that kind of shed some light on this. It's a topic that everybody's going to continue to deal with. So this is like part one of many to come, many more to discuss. We are not solving the problem, but it is good to identify and call certain things out and make clear racism is racism. Within the healthcare system, it is racist, and we need to work on that. I mean, we talked about a lot of things. I shared some of my doctor experiences and what I see with patients, but also we didn't feel this was a doctor bashing session, but also identifying the issues within the healthcare system that need to be fixed and how people actually can solve some problems. They can be a patient advocate for themselves, going to an ombudsman or a specialist that's within the hospital system that can link with the CEO, understanding how to navigate those things. I think will probably improve healthcare outcomes. And we talked about Obamacare and the current healthcare plans that are out there. I think those are also important for people knowing how to access it. And if you need to, you can go to hhs.gov and you can go to cms.gov. Those are that's the health insurance company, and HHS is the big health entity that does the whole health or is in charge of the whole health system for the United States of America. So.
And I think the most important thing is just not ignoring the fact that racism and sexism is happening. We have to talk about it, and awareness is the first part.
You gotta call a spade a spade. Call it out for what it is.
I agree. And it is a microcosm of our society. So it's what we're all experiencing on the real thing.
Absolutely.
But this ends the episode on healthcare disparities, humility of humanity. Thank you for joining us.